Everyone, this is Dr. Ahmad, and today we're going to start a new series in our USMLE Step 1. And in this one, we're going to start with the gastrointestinal system. We're going to start with the basic anatomy. We're going to start with the surface anatomy of the abdomen. Then we're going to go deeper into particular organs. Then we're going to look into histology, physiology, then pathology, and finally pharmacology for the gastrointestinal system. But we're going to have to take baby steps into this thing. So right now we're going to start with the surface anatomy of the abdomen. This is going to be a simple presentation where we're going to learn different surface landmarks, the reference lines and planes, the position of the organs according to those landmarks, and dermatomes. So the surface landmarks of the abdomen has we're going to have to start with the superior border, which is made from the xiphoid process. The xiphoid process, as you know, is the lower portion of the sternum, and extending from it, you're going to go on the lateral side of the abdomen on both sides at the costal cartilages, which then span from 7th costal cartilage to the 10th costal cartilage or rib. Then we have a middle plane. This is the middle area of the abdomen, and it is at the umbilicus. So this is the area that separates the right abdomen from the left, and there is a medial line that goes through it. If you see on the abdominal region, if there is no fat on the overlying and you see a very lean muscle over there, you see the six pack. So that the basic middle line that divides it is called the linea alba, and either side of it of the umbilicus is the two regions, or the right and left. The umbilicus is present between L3 and L4 vertebrae. Then we have the inferior border. The inferior border is the pubic symphysis, and it is present at the most inferior part of the abdomen. The inguinal ligament is created by the inferior border of the external oblique muscle and its aponeurosis, and it extends between the anterior and superior iliac spine and pubic tubercle. So if you look at here for the surface landmarks, right here is the xiphoid process. This right here is the pubic symphysis. We have the umbilicus right there. So if you see this specific picture, you see the two muscles on the right and left side. These are the paired muscles right here, and this is in a layman terms it's called six packs. Yeah, we're gonna look into the specific name of this muscle later into the further when we look into the series of the gastrointestinal system and the anterior lateral abdominal wall, but let's save that for the lateral later time. So xiphoid process is right here. You see the two ribs that goes from here, start from 7th to 10th rib all the way down there. So xiphoid process, and the superior border is made from there right here for the costal margins, and then we have the umbilicus right here. Then the pelvis from here to here and here to here, this whole area is the inguinal region, and this one right here is the pubic symphysis, and pubic tubercle is right here. So there is this groove that divide the abdomen in the left and the right side. So this one is called the linea alba. So abdomen can be divided into four quadrants, and it can be divided into 9 different regions depending on how the division is done. So the quadrant of the abdomen is basically 4. And if you devise a line that goes through the abdomen from the sagittal and the transverse plane, if you divide the abdomen in those two planes, which actually intersect at the umbilicus, the the quadrants can be identified from there. So the transverse plane is a transumbilical plane which crosses the abdomen at the level of the umbilicus. It is go from basically it's horizontal. The sagittal plane is a vertical plane, and it crosses the body at the level of the umbilicus as well. So it goes from up to down, from superior to inferior position. So this intersection will define 4 quadrant. So I have put down the abbreviations here: RUQ, LUQ, RLQ, and LLQ. So let's see. So right upper quadrant is RUQ. So you see here it's a median plane, or it's called as the sagittal plane, and the other plane that goes through the umbilicus right here is the transumbilical plane. So we have the right upper quadrant, or RUQ, left upper quadrant LUQ, right lower quadrant RLQ, and left lower quadrant, or LLQ. Now we're going to look into the 9 different regions of the abdomen. So this is a different division or classification of the abdomen, how it is divided. So there's 9 regions, and it happens through the intersection of 2 lines, which is basically the mid-clavicular plane. So if you extend a line from from clavicle from top to bottom, from superior to inferior, the middle of the clavicle on either side, those are the mid clavicular plane. So these are the upper horizontal structure, the subcostal plane, and then the lower horizontal tubercular plane. So those two lines that goes from both clavicles from top to bottom, and then the transverse or the horizontal that goes through the subcostal area and the lower quadrant and the lower horizontal transtubercular plane. So again, it's a little bit of a definitions right here. So the midclavicular plane is the vertical plane that extends from the midclavicular lines to the mid-inguinal points. The upper horizontal or the subcostal is the inferior to the costal margin at the level of L3 and 10 subcostal rib. And the lower horizontal is transtubercular, crosses between the two tubercles of the iliac crust at the level of L5. So these planes define the 9 regions again. So centrally, if we start and take the middle 3 regions, so if that is the central one, so superior to inferior is the epigastric region, umbilical region, and the pubic region hypogastrium. Then the right and left is from superior to inferior, so either right or either left. You can take right and left hypochondrium, right and left lateral abdominal regions or lumbar regions. Those names are used interchangeably, and the right and left inguinal regions. So based on these location and the knowledge of organs in those regions, if the patient is presented with the symptoms, that will actually tell the skilled clinician to how to shortlist the number of differential diagnoses. So for example, if there is a problem on the right lower quadrant or the right inguinal area, then you basically figure out, okay, these are the structures that are present here. According to the symptoms, which organ I should be looking for, what type of tests I'm going to be ordering. Again, this is right here, the abdomen is divided into 9 different regions. So these two lines right here is the mid clavicular lines or planes. This is the for the hypochondric area, that's the subcostal plane, and this is the inguinal. So you look here, you see epigastric region, umbilical, and hypogastric. So these 3 regions right here, they are distinctive. So on the either side, this is right and this is left. Remember, you're looking anteriorly. So this is the left hypochondriac region. This is the right hypochondriac region. This is the left lumbar region, right lumbar region, and the right inguinal region and the left inguinal region alongside the hypogastrium. So let's look at the position of the organs dependent upon the quadrants. Remember, there are 4 quadrants. So let's start with the right upper quadrant. So what organs that you can find here? So you have liver, you have stomach right there, you have a gallbladder that is like perfectly tucked away under the liver. You have the duodenum right here. You have the right kidney, a small one back there. Then you have the transverse colon right there. After that, you have a portion of the small intestine that is present. So left upper quadrant, you see different organs right here. Liver again make the portion of it. You have the left adrenal gland that you can see behind this stomach right here. Liver and stomach is on the posterior side of the abdomen. You see stomach in itself, left kidneys back there, transverse colon, and the portion of the small intestines. Then you look at this is the transumbilical plane that we discussed before. Let's look at the right lower quadrant. Again, you have a big portion of the small intestines. Then you have a large intestine. Then you have appendix right here. After that, depending on the gender, we have the reproductive organs that are present in this area as well. Then looking at the left lower quadrant, you have big portion of the small intestine, large intestines. You have the reproductive organs present as well, sigmoid colon as well. So looking at the position of the organs depending on the region. So this is a different scenario right here. So we have 9 regions. So you see liver, it's extending from right hypochondriac region into the epigastric region, and a very small portion of it could come into the left hypochondriac region. But basically this major area is basically made up from the spleen and the part of the stomach and some of the splenic flexure that's over there. For the large intestines, you have stomach in the epigastrium, you have liver, you have part of duodenum right there, bile ducts, and gallbladder, and depending on the regions. Umbilical region is mostly up to entirely made up from the pancreas and other duodenum, small intestine, transverse colon. That's how it's made up from. Right lumbar region made from the ascending colon, small intestines and right kidney. Left lumbar region is made from the descending colon, small intestines and left kidney. Hypogastrium, bladder, sigmoid colon, small intestines and reproductive organs. Right iliac region, appendix, right iliac or right hypochondric. Its appendix, cecum, ascending colon, small intestines, and the left iliac again, sigmoid colon, descending colon, and small intestines. So this was for from the anterior aspect. So looking from the posterior aspect, you see again you see the liver right there. You have a part of the stomach or spleen, sometime visible over here, large intestines that you can see, small intestines, and then you have the kidneys. So if you remember your lectures from the renal system, if you want to look at the playlist over there, you'll remember that the right kidney is pushed down a little bit, then from the left kidney because of the liver that's actually pressing it down. You're looking at it from the posterior aspect. This is going to be the final slide of this presentation. This is the nerve distribution to the abdomen. So nerve distribution of the abdomen is basically, let's start, it's mostly made up from the thoracic spinal nerves. So at the umbilical region, you have T10. So the most of the entirety of it is made from the T7 to T12. So sorry, T7 to L1. So in this diagram or in this picture, you see that at T10 level is basically the umbilicus. Above it, the structures are supplied by T7, T8, and T9. Below that is T11, T12, and L1. So here's different organs that are supplied by different nerves. So you see liver is supplied by T6 to T9. You have kidneys on both ends, T10 to L1. You have stomach, T6 to T9, T6 to T8. So depending on the region, if you have a basic idea that at the umbilicus, which is right here, so you have mostly T10. So you look at the T10 that is supplying, then you have T12, L1, depending on the plane. So the plane, how it intersects, is actually going to give you an idea how it is supplied. However, on the lowest point, it is some of the innervation is from the S2 and S4. So with this slide, we're going to end our discussion right here with the nerve distribution of the abdomen. These are just basic overview of the abdominal region. We're going to look further into each and every organ, their pathologies, and everything else in the later presentation. Thank you so much, and I'll see you soon.